Hi Mariam, my name's Adonia. I'm going to be your student nurse for today. How are you feeling?
Right, not too bad, thank you.
Okay. So I can see on the chart here that you're going to be administered some morphine PCA. And I'll explain what that is a little bit later on, but it's just to help manage your pain. Can I just confirm your full name, please?
Sure, it's Miriam Adib.
Yeah, so Mariam Adib, yeah. Your MRN 174963, 174963, correct. Can I just get your date of birth as well?
7th of the 1st, 1969.
7th, 1st, 1969, okay, that's correct. Do you have any allergies?
No.
Okay, good. And just regards with your pain, where are you experiencing this pain?
Just in the chest area.
Okay, so where you've had the incident?
Yeah.
Okay, and your pain score out of 10, 10 being the highest, 1 lowest, and 5 moderate, what are you experiencing at the moment?
So it's about an 8 at the moment.
Okay, so it is quite high. And how long has this pain been happening?
Since the accident.
Okay, no worries. And I'm just going to assess your cannula site really quickly. When did you have the cannula put in?
They put it in this morning.
Okay, so it is within 72 hours.
Sodium chloride. I've got 50 mils of this, so sodium chloride September 18, sodium chloride September 18, sodium chloride September 18, sodium chloride.
Okay, so are you experiencing any pain when I touch?
No.
Okay, and I can't see any inflammation, swelling or redness or any signs of phlebitis, so it looks okay to me. But if you do experience any pain in the meantime, make sure you do let us know, please. Okay, I will be back, and when we come back, we are going to assess your vital signs just to make sure that everything's okay. But if you need anything in the meantime, just press your buzzer.
Thank you.
So I'm just going to validate my medication order for Mariam Adib. So we've got here Mariam Adib, MRN 174963, date of birth confirmed by the patient. She also let us know that she's got known allergies, and this is going to be given for her morphine 50 milligrams per 50 mils, which has been signed and dated by the doctor with their page number as well. So we've got here the PCA IV morphine, 50 milligrams morphine and 50 mils of saline. Concentration is 1 milligram per mils. Number of syringes that we're going to be using are 3. PCA dose is 1 milligram. Lockout interval is 5 minutes. There is no basal infusion, and the hourly dose limit is 12 milligrams. This has also been signed by the doctor. And we've got down here antiemetics in case the patient does feel nauseous after being given the morphine. So we've got here metoclopramide, 10 milligrams IV, signed and dated by the doctor as well. And we've also got here naloxone, dose and route is 0.2 milligrams IV, intervals 2 to 3 minutes, also signed by the doctor. So are you happy with this order?
Yep.
Okay. I'm just going to check the morphine from the drug cupboard. The morphine on page 18. Okay, so we should have 45 in there. I'll just check that. Okay, so we'll just count that to confirm. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 40. 1, 2, 3, 4, 5, it's 45. So we're going to take 5 out as per the order, so morphine 50 milligram. So we're going to be needing 5 vials of these, so 10 milligrams, that will make up 1, 2, 3, 4, 5, so 50 milligrams in total as per the order. So I'm just going to write that in. Time is 11:10, and that is for Mariam Adib. So 50 milligrams is what we need. I'm not discarding anything, and we are going to be left with 40. I'll just double check that as well. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's 40, which we'll be putting back in the cupboard. And the prescriber is L Hunt. Print name, so that's myself. And my signature, and if you're happy with that, you just want to sign. Sure. Okay, so I'm happy with that. And I'm just going to take that medication back to Miriam. Okay, so I'm going to do my first drug check. So this is for Miriam Adib. MRN and date of birth have been confirmed. She has nil known allergies as confirmed by the patient. So we're just going to be checking the morphine 50 milligrams per 50 mils. So we've got here the morphine sulfate injection, 10 mils per 1 mil, expires 10 to the 20. So we've also got here morphine 10 milligrams 1 mil, expires 10/20, morphine 10 mil 1 mil, 10/20, morphine 10 milligrams per 1 mil, 10/20, morphine 10 milligrams 1 mil, 10/20. So that's all within date and the correct drug as per the order. And this is going to be diluted into sodium chloride 10 mils with a total of 50. So sodium chloride 10 mils, sodium chloride 10 mils, sodium chloride 10 mils. 10 mil here, and it expires 17 November 17, 17, 17, so that's all within date. This medication has not been given today, so we are going to be administering it now, and it is going to be given via IV route. And as per calculations here, we've got the 5 ampules, so 1, 2, 3, 4, 5. And that is going to be drawn up into 5 mils total volume. And with the sodium chloride, we need a total of, we've got a total here of 50. We're going to be discarding 5 mils to make up 45 mils. And then we're going to be adding it with the morphine 5 mils to make up a total of 50 mils as per the order. Okay, so we've gathered all our equipment. I've got the PCA line, I've got 50 mils of the sodium chloride, 1, 2, 3, 4, 5. We're going to be discarding 5 mils to make up 45. And then we've got the morphine sulfate, 10 milligrams, 1, 2, 3, 4, 5. That's going to be drawn up as 5 mils as per calculation. Got a drawing up needle, alcohol swabs, additive label, and a syringe as well. I'm just going to do my second drug check with you. This is for Miriam Adib, MRN 174963, date of birth 7 on the 1st, 69. She has nil known allergies as confirmed by the patient. This medication that we're going to be giving her today has not been given. So the medication is morphine 50 milligrams, 50 mils, which is what we've got here. Morphine sulfate 10 milligrams per 1 mil, expires 10 to 20. Morphine sulfate 10 milligrams 1 mil, 10/20. Morphine sulfate 10 milligrams 1 mil, 10/20. Morphine sulfate 10 milligram 1 mil, 10/20, and morphine sulfate 10 milligram 1 mil, 10/20. So I'm happy that this is the right drug to be given, and we are going to be giving 5 mils of this drug as per order, and that is going to be mixed with 45 mils of sodium chloride. So just to confirm, we've got here sodium chloride 0.9%, 10 mils, expires November 17. Sodium chloride 10 mils, expires 17. Sodium chloride 10 mils, expires 17. Sodium chloride 10 mil, expires 17, and sodium chloride 10 mils, expires 17. So we've got a total of 50 mils, discarding 5, left with 45 to be mixed with 5 mils to make up the 50 mils as per order. It is going to be given via PCA intravenously. We're going to be using these concentrations through the machine. And ready? Also has been signed and dated by the doctor.
So now before I medication to do my second drug check, would you be able to assist? Yep. So in vaccine, I have 15 milligrams of morphine sulfate, like morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, and morphine sulfate, and all 10 milligrams, so 10, 15, so to this 15 milligrams of morphine. I have frequency, which is 45 mils of sodium chloride, but that's to methylprednisolone. So 10, 20, 50 mils of expired 2015, and then morphine expired 2020, 2020, 2020, I have patients in the disease, the daily rate is 7 plus 969, and around it's 117, morphine for post function use, allergies, so morphine BCA is concentration of 1 milligram per mil, so 3 syringes for administering 1 mil, BCA dose is 1 milligram. Alright, people is 5 minutes. There's no basal infusion. There's an abstinence adjustment. Hearing is 12 milligrams. Doctor assigned the patient is and is over. Great. Okay. This is the next second patient with a routine check. Hi, Mary. This is Angela again. Just before I give your medication, I need to check your identity once more. So would you mind telling me your first name, your full name and date of birth?
It's Miriam Gibb, and it's the 7th to the 1st, 69.
So I've just drawn up 50 mils of the sodium chloride, 0.9%, 10 mils, which is what we've also got on the order here. To be drawn up with morphine 50 milligrams, 50 mils. So I've got the morphine sulfate injection here, which I'm also going to draw up into the same one as well. Yeah, so I've got 50 mils here. Okay, so I've got the 50 mils of my normal saline and morphine together. So I've discarded 5 mils of the 50 mil of sodium chloride to make up the 45 mils. And I'm also drawn up 5 mils of morphine sulfate. And altogether I've got 50 mils. Do you agree with that? Yes.
Yes, I'm grabbing numbers. Yeah, because you want to my
Mary Madib, MRN 174963, 174963, date of birth 7/1/69, and the medication that we've got is morphine sulfate, 50 milligrams and 50 mils, which equals to 1 milligrams per mil. It's diluted at 0.1% sodium chloride, and if you can just sign that you've checked that, please. Thank you. Hi Miriam, I'm back again. I'm just going to do your second patient check just to make sure that it's all correct. Can you state your full name for me, please?
Miriam Adib,
Yeah, and your date of birth?
7th of the 1st, 1969.
Yeah, 7/1/1969, and your MRN 174963, 174963. Are you allergic to anything?
No.
Okay. Before I do administer your medication, I'm just going to tell you a little bit about the PCA machine. So what it is, it's a patient-controlled analgesia, which will help with your pain. And the way that it is used is that it has these little buzzers. All you need to do is you need to press this button when you feel that you are in pain. And what it will do, it will administer that medication for you. However, there is a 5-minute lockout, so it doesn't matter how many times you press, it will only administer within that 5-minute period. And another thing that I need to tell you is that you may experience a little bit of tummy aches, you may feel a little bit nauseous. If you do feel any of those, we do have some medication charted for that, but please let us know if you are experiencing any of those symptoms.
Okay, thank you.
Okay, thank you. Okay, so I've just explained to the patient how the PCA machine works, so she's got full understanding of that.
Okay.
I'm just going to do my third drug check. So this is for Miriam Adib. MRN confirmed, date of birth confirmed, all correct. She has nil known allergies, and this is for morphine 50 milligrams and 50 mils, which is what I've got here. So morphine sulfate 10 milligrams per mil, expires 10/20. Morphine sulfate 10 milligrams per mil, expires 10/20. Morphine sulfate 10 milligrams per 1 mil, expires 10/20.
Yep.
Morphine sulfate 10 milligrams 1 mil, expires 10/20. Morphine sulfate 10 milligrams per 1 mil, expires 10/20. And this is what I've also got drawn up. So I've got the 45 mils of the normal saline, mixed with the 5 mils of the morphine, which is what we worked out previously.
Okay.
And this is the sodium chloride that I've used. The sodium chloride expires September 18, which is within date.
Yep.
Sodium chloride September 18. Sodium chloride September 18. Sodium chloride September 18. Sodium chloride September 18.
Okay.
And that has also been charted with the date and signed by the doctor. So the concentration of the PCA is what we're going to be giving is the concentration is 1 milligram per mil.
Yep.
Going to be using 3 syringes. The PCA dose is 1 milligram. Lockout intervals 5 minutes.
Yep.
Basal infusion 0 milligrams per hour. And the hourly dose limit is 12 milligrams. And that has also been initialed by the doctor. And we have also got these antiemetics charted if the patient does feel a bit nauseous or a little bit sick.
Okay.
Hi Mary, we're just going to get this machine ready for you. Okay, so this is for a new patient, yes. Confirming, yes. Okay. So we've already got it set on morphine. We're just going to modify the details to make sure that it's all correct. So we've got here the drug name morphine, which is what we've got here on the order. The drug concentration is 1 milligram per mil. So the concentration 1 milligram per mil.
Yeah.
PCA dose is also 1 milligram. PCA dose 1 milligram.
Yeah.
The lockout period is 5 minutes, which is also what we've got here, lockout interval 5 minutes.
Yeah.
We don't have a continuous basal infusion, so that's 0 milligrams, 0 milligrams. There is no loading dose, and the max limit, we need to change it to 12 milligrams.
Okay.
So we're just going to alter that. So 12 milligrams, 12 mils, 12 milligrams. Confirming. And we've got the duration of it to be 1 hour,
Yep.
and it's a stat dose.
Okay.
Just confirming that. So you're happy with all those details?
Yep.
Okay.
So prior to administering the morphine, I will need to take a baseline vital signs and also and record it here. And also after that, every 15 minutes, once I've administered the morphine, I will also need to take the vital signs just to record.
Hey Marion, we're just going to connect the PCM machine to you.
Prior to administering the morphine, I will need to take set of a baseline vital signs and record it here, the observation chart. And also,
Okay, so we're just going to go next protocol.
Yep.
Okay, so we're just going to confirm that we've got morphine 1 milligram per mil, 1 milligram per mil. There's no loading dose. PCA dose is 1 milligram, 1 milligram here.
Yep.
Lockout's 5 minutes. It's not a basal infusion, so it's not continuous. And it's 12 milligrams hourly dose limit.
Yep.
So we're happy with that. We're just going to change the type of the syringe. And that's Terumo. Okay, so we're just going to start the PCA. Okay. Hi Marianne, I'm just going to explain this quickly to you. So the way that this works is you just press the button, and while I'm here I'll get you to press it to make sure that it's all working. Okay, so I'll make that noise to let you know that it's actually giving you that first dose. Okay, so you can press it as many times as you like. However, it'll only give you that lockout period every 5 minutes. Is that all good?
Yes, thank you.
Okay, so I'll be back in 15 minutes to check up on you. If you need anything, do press your buzzer and let us know.
Thank you.
Thanks. Okay, so today is the 29th of 3rd, and the time is 10 a.m.
Thank you.
Thanks.